Hi, this is Dr. Steven Feldman. I am Professor of Dermatology, Pathology, and Public Health Sciences at Wake Forest School of Medicine in Winston-Salem, North Carolina. This is the orange line, in which we will discuss the landscape of biologics in the United States and the impetus for biosimilar development. To begin, let's start by talking about the expenditures from a patient perspective on biologic treatment. Here we have data on average out-of-pocket expenditure for biologics by year and by medication. And you can see over the last 10 years, there's been a steady increase in patients' out-of-pocket expenses. Now, for revolutionary treatments, these expenses may not seem enormous. On the other hand, they can affect patients' willingness to go on and stay on these treatments. Here we have the rate of prescription abandonment by out-of-pocket costs. Now, this is one of the critical aspects of adherence to treatment. You would think that patients with severe immune disease, given a very effective therapy, would take their medicine, but as their out-of-pocket costs increase, there's a greater and greater likelihood that they're not going to fill the prescriptions. Even when they fill the prescriptions, they don't always take the medication. I like to ask my patients who are on self-injected biologic treatment, are you keeping the extra injectors that you've accumulated refrigerated like you're supposed to? Patients think that I'm asking about refrigeration, and if they've accumulated some, whether they're refrigerated or not, they'll probably tell me that they are refrigerated. But this is a way I can tell whether patients are taking their medicine or not. If they're taking it properly, they would tell me, I don't know what you're talking about. I don't have any extras lying around. So we have to keep adherence in mind, both primary non-adherence from not filling the medication in the first place, which can be due to the cost of drugs, and secondary non-adherence where they get the medicine but they don't take it well. Why are people interested in biosimilars? Well, first of all, biologics have revolutionized the treatment of inflammatory diseases. I specialize in the treatment of psoriasis, and biosimilars have revolutionized my ability to care for my patients with severe psoriasis. But at the same time, biologics are very expensive. Drugs for rheumatoid arthritis may cost $50,000 a year, and those costs have progressively increased. The cost of tumor necrosis factor inhibiting drugs have doubled since their introduction. Now, biosimilar introduction in Norway led to a nearly 60% annual savings. The estimated cost savings in the United States is something like $66 billion predicted over the next decade, which is a big number, even though it may represent only a small proportion of the total expenses on biologics. The Affordable Care Act of 2010 was designed to improve access to innovative medical therapies, and so it created a pathway so that biosimilars could be developed, with the goal being to bring down the cost and increase access to these revolutionary drugs for our patients.
Now that we've learned about the landscape of biologics, let me summarize what we've covered. Biologics have revolutionized the treatment of severe inflammatory diseases. They're very safe, very effective, and very costly. Biosimilars are an exciting development because they may help us reduce that cost somewhat.